premenstrual syndrome, or we call it as PMS, as you say. Premenstrual syndrome is a fusion of disorders, basically emotional and physical symptoms the patient is having, that starts approximately 7 to 10 days before the menses, and it waves off, and the symptoms waves off around 2 to 3 days after the menses starts. Premenstrual syndrome is an array of some physical and emotional imbalance. As the patient, some patients who are in not having a proper lifestyle, and obese patients may have high risk. It most common in early ages, in 20s and 30s of second and third decade. And there's a hormone called the serotonin that is secreted in our brain. And when the serotonin level is low, like the patient is not happy or having anxiety for something, then in these patients, PMS or premenstrual syndrome occurs more commonly. If there is any stress in life, work-related stress, or any other stress in life, that leads to premenstrual syndrome actually. Signs of premenstrual syndrome, as I said, it's a fusion of emotional and physical symptoms. So the patient may feel anger and anxiety. She may have lower abdominal pelvic cramps, breast tenderness, and heaviness in breast. Some patients may feel fatigue, irritability, and they may, few of patients complaints with migraine headaches. And some patients feel like binge eating. They have to eat everything junk and all that, and that may in turn increases more the symptoms of this PMS. PMS lasts approximately as soon as it starts 7 to 10 days before your menses. And as soon as some patients has started their menses, or within 2 to 3 days, the symptoms waves off. The most of the patients are in the age group of early 20s, and up to 30 or 40 years, patients are suffering from PMS continuously. That may be. And after menopause, it waves off. The symptoms of PMS waves off, obviously, because it's a premenstrual syndrome. At the age of menarche, like whatever it is, 12 or 13, 12 to 14 years, initially there's no ovulation, and so there's no pain and all that. But as the ovulation starts within a few years of the menarche, the pain starts. And sometimes the young girls are so stressed out nowadays because of their working and teaching, studies and all that. So this will lead to a stressed life, and the PMS is nowadays getting more common. So early 20s and 30s is more common, but it may last in a woman up to 40 to 45 years of age also, till she attains her menopause. And after menopause, there's no PMS. You have to work on your emotional aspect and physical aspect both. First of all, change your lifestyle. You have to manage your weight. Do regular exercise at least 3 to 5 times a day for 30 to 40 minutes. It may be any kind of exercise like brisk walking or swimming or gymming or any kind of yoga. Meditation may also help in PMS, because it calms your mind and gives you a relaxing feeling. And serotonin hormone is increased more. You'll feel more happy, and you'll feel relieved in your PMS symptoms. Few of the patients suffer it from every cycle. It may last for a few years or up to 10 years, or as I told you, from menarche till menopause. It depends on the hormonal status of the patient actually, because every patient has a different level of hormones. So the balance of the hormones like estrogen and progesterone and prolactin, serotonin, all these hormones are related to hypothalamic pituitary axis that works from our brain. So as I told you, as the patient changes her lifestyle, she can get relieved from the PMS slowly. But if she'll continue to get in that stressful lifestyle, so PMS occurs before every cycle and it continues year through years.